I'm here with Dr. Raymond Berke. He's a client of ours. Ray had a spinal cord injury and receives care. First of all, Dr. Berke, can you tell us how you got a spinal cord injury?
Yes. About 9 years ago, I was in Chicago and staying with a friend of ours. And in the building, to go outside, there's a vestibule to keep out the cold weather. And I was going through that vestibule and apparently tripped as going into it and fell across it and hit my chin on the bottom step, and that hyperextended my neck, and it caused my spinal cord to be injured.
I see. So let's fast forward to when you realized you would need care, at least possibly for the rest of your life. What point was that?
Well, immediately, really. Well, first of all, I don't have any real memory of my accident. I fell and I was unconscious. I had no recollection of actually falling, had no recollection of the hour or so before I fell, and I woke up 3 days later in the hospital. That works.
I see. Did you know, when you woke up, did you know you were paralyzed at that moment?
But I do recall waking up and realizing I had a tube in my mouth going down into my trachea, and this was before I had the tracheostomy, and of course that was very uncomfortable, and I knew I had something serious, very serious, going on, and my children were in front of me, and I was unable to talk, but I mouthed, and what I was trying to say was, please pull this tube out and let me die. But that was the last time I really felt that way.
Sure. Obviously, you've done a great job of moving on. How has having a caregiver affected your life, and a lot of the differences that we see between somebody who typically cares for the elderly and now is caring for somebody with a spinal cord injury impact you greatly? What's a couple of things that you think are greatly different between caring for an elderly and caring for somebody with a spinal cord injury?
We try to lead a relatively normal social life as well as we can. I do go out to lunch with friends 3 times a week. We generally have dinner out once a week or so, go to movies, and basically lead as normal life as possible. And for that, I don't want my wife feeding me, so when we go out, my caregiver must do that.
Is there an attribute, something that you notice in a caregiver right away that you think will make them a better caregiver, specifically for somebody with a spinal cord injury versus, again, somebody coming out of the hospital or aging related?
I think they have to be probably more intelligent. They have to be able to have the strength to move me about in bed, to turn me at times, and move me to help move me so that I could be lifted up with a Hoyer lift.
And is the intelligence just having the insight to know that you don't have feeling and there are certain things they're just going to have to be on top of?
Well, they do have to be on top of things. They have to look out for pressure wounds very carefully, check my skin.
Now, I notice you have a lot of technology on you. Do they need to know this technology, and is it easy to learn for a caregiver?
Well, the technology I have is really an aid to me to do voice-activated things. So they don't need to specifically know the technology. However, they need to know how to set it up for me. So that, of course, is necessary.
What advice would you give somebody who is just facing this condition recently, and they're realizing they have this road ahead of them?
Well, at some point, you have to realize that if you want to have a life, you have to think positively. And my only thought when I realized what situation I was in was that if I'm going to make a life for myself, I have to be positive about this and not dwell upon my injury. I've
Yeah, you've outlived your life expectancy by quite a bit. Would you say this is primarily because of a positive outlook and trying to live a normal life?
Well, I'm sure that's a good part of it. I think obviously having good care was essential.
So caregiving and the caregiver that you choose, you think impacts your life greatly.
Absolutely.
There are not a lot of spinal cord injury care recipients out there compared to the rest. And we
Obviously.
think that this gives, that means that it's an underserved clientele. So naturally, when a caregiver walks in the door, they're not used to a spinal cord injury situation.
Right.
And so you would advocate for more training relative to spinal cord injury.
Well, it would be nice if there were more trained people. However, mainly they're getting training on the job, and that takes some time. And obviously, a more intelligent person is going to be trained more quickly than one who's not.
How long do you think it takes an average caregiver to get up to speed with caring for you adequately and any other person in your situation?
I would say at least a month.
So about a month's time.
That's
There's a
what-
lot of things to know.
That's a guess. But yes, there's a lot of things they have to know, where things are, when I have to use them. Although if they don't, I'll tell them.
Sure.
I do have the ability to respond and know what's going on, so I could inform them of all these things. But I'd rather be thinking about other things.
Yeah, sure. Well, Dr. Berke, I appreciate your time today.
All right.